Welcome. This is Mental Health Matters. In this installment, I'll be discussing the definition of mental health. What is mental health? And what does it mean to be mentally healthy? The status of someone's mental health is determined largely by the healthy function of mood and emotions, of behavior, of thought processes, and of relationships. But how are we to determine if those are in fact healthy? When it comes to physical health, doctors have objective measures such as blood tests and x-rays to determine health or illness. However, there's no parallel to such tests in the field of mental health that can objectively determine whether someone is or is not healthy. Mental health professionals have to rely on subjective information, that is, information that is gathered from people based on their perceptions. They have to examine what symptoms a person might be experiencing, and they have to look at these from multiple angles and often obtain information from multiple sources. Common questions mental health professionals typically consider in trying to make sense of this information include things like, are these things the person is experiencing causing them suffering? Are their behaviors or emotions helping them deal with their circumstance in an effective way, or are they making it more difficult for them to deal with that? Are their behaviors, speech, thoughts, or ways of relating to people common and typical, or highly uncommon and unusual? Do people's moods, behavior, relationships, or thought processes violate some kind of social standard or cultural norm? Are their behaviors or thoughts or moods rational? Are they irrational? Is there a way that these people or that people might be acting or relating or interacting with other people, posing some sort of risk to themselves or to someone else? Are they behaving dangerously? Are their moods causing them to feel like they want to do dangerous things? These again are some of the questions that we have to ask. Of course, no conclusions can be drawn from the answers to any one or two of these questions. But what mental health professionals do try to do is gather information and answers to several of these questions, as many as possible, in an attempt to piece together an understanding of what this person might be experiencing, how their problem that they're having has come to be, and to help them formulate a way to improve how they're thinking, feeling, or relating. So in sum, mental health is not defined by how someone is functioning in one particular area. It involves considering how an individual is functioning in several important areas, including their moods, emotions, behaviors, thought processes, and relationships with others. Thank you for watching today and doing your part to fight stigma of mental health problems. Stay tuned for future installments of Mental Health Matters for accurate and reliable information about a broad range of topics related to mental health. Your feedback, questions, and comments are more than welcome. Please send them to me by visiting drdbrownstein.com, facebook.com/drdbrownstein, or on Twitter @drdbrownstein. Remember, mental health matters.